This is the NU 209 health assessment skill check off for respiratory. And I do apologize, I am sounding a little bit under the weather. So let's get into it. I'm not using an actual patient. I'm actually quarantining at the moment. So I'm going to be using a teddy bear. And the teddy bear will just be going by Barry Bonds because it's the closest thing I can think of. So patient today is Barry Bonds. I'm going to introduce myself. My name is Neo, and today we're going over the respiratory system. I'm also going to be asking for a name and date of birth. His name is Barry Bonds, born April 15th, 1997. Okay. From this point on, I'm going to be explaining what I'm doing. So basically, what the procedure here is today is I will be inspecting, palpating, and auscultating your areas in the respiratory system. So I'll be inspecting your lungs, condition, just how they look like visually. I'll be looking for expansion, and I'll be percussing other things down to make sure everything is checked out fine, and also be counting for respiratory rate. But since I can't count the respiratory rate, I'm going to give out a normal average respiratory rate in a young, healthy adult. So usually you would ask the patient questions such as, do they have a cough, shortness of breath, any chest pains when they're breathing, do they have any history of respiratory infections, are they smoking, do they have environmental exposures such as like allergies or places they work in, like places in like construction, places that dealt with asbestos, if I'm saying that right. If they have any pneumonia, or do they take part in any pneumonia, influenza, immunizations, and all that. So from that being said, let's do this. So, Mr. Bonds, just going to be counting respiratory rate. Usually you would listen in the lungs for that, count. But for the sake here, I'm going to be listening for like a short time. So respiratory rate there would be 15, pretty common in a normal healthy adult. So then from here, I'm going to be inspecting the thoracic cage. So basically the thoracic cage would be anywhere right here, basically right here in patients. So usually a normal thoracic cage would be pretty healthy. No visible masses or anything like that. So it's pretty good. Patient's position right now, sitting up straight. I have it leaning on a pillow so it doesn't just fall back, but overall sitting up straight, 90-degree posture. Yeah. And because it's a teddy bear, I really can't speak on facial expression, so patient's facial expression would be relatively normal. And their level of consciousness, they're pretty awake to me, it looks like. Now, you'd be watching for symmetric expansion. So when the patient takes a deep breath in, their thumbs should be spacing out pretty. Okay, so when you watch a patient breathe in deeply, the patient's thumbs are supposed to basically move apart equally as the patient is taking a deep breath. With the teddy bear, I really can't do much, and since of given conditions, I'm quarantining, and patient took a deep breath in, and thumbs moved apart equally just fine. So that's it. So now I'll be palpating for tactile firmitis. Basically, what happens is right here, I would be palpating the back of the patient's hand, and I would ask them to repeat 99, and I would feel for the vibrations while the patient says 99. So right here, patient would be saying 99. I'd be feeling for vibrations, and if I feel them, it's perfectly normal. Another thing here is we'll be looking for any strange lumps, masses, tenderness, and temperature in the lungs area. So basically, like around here in the back, if a patient had tenderness, they would almost flinch to it. Obviously, any lumps and masses you would be able to see visually, and temperature, it would be just a little bit more hot or warmer to the touch than anywhere else on the body. And now I would percuss the lung field, starting from between the ribs and the clavicle down. So about right here. And you would stop right there. And then you would just watch for symmetric expansion and tactile firmitis. Basically watching the patient almost breathe, almost. And then on this patient, obviously no lumps, masses, or tenderness reported. So yeah. And then here, I'm going to just assess for normal breath sounds. But since I can't do that, I'm just gonna auscultate the usual lung spots where you would get auscultated from at the doctor's. So I think it's better if I show it for myself, actually. So it'd be here, 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 and here. And then on my back, I can actually show this on the teddy bear. The back would be here, 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 and here. And all of that would be done with the wider end of the stethoscope or the diaphragm. Other than that, that should be it. If usually there was no visible problem with the patient, then the patient's respiratory system is usually fine, and they're perfectly healthy. Usually, you would have a lot of usually be paying attention to a lot more things if the patient was a said smoker or had any history of a respiratory infection or even being exposed to the flu. So with that being said, that concludes respiratory, and if I do need to redo this, I will do it. So thank you.